see that? Okay.
5.
All right, you guys are good to go.
Thank you. Okay, hi, everybody. Thanks for joining.
Oh,
I see we have a quorum, so I'm just going to make sure we're all here. I see Toby. I am here myself. I see Tyler, and I see Jim. And I guess that Brenda will be late, and I haven't heard anything from Bill, but we do have a quorum. So the next thing is to the Pledge of Allegiance. Yes, we can stand. I pledge allegiance to the flag of the United States of America and to the
and to the
republic
republic.
which stands one nation under God, indivisible, with liberty and justice for all. So I guess I do need to call the meeting to order. Do I need to do that? Call the meeting to order?
Sure.
Oh, thank you. All right. I'll call the meeting. Do I get a first or a second?
A second.
All right. The meeting is called to order. Okay. So we have Janet's here from staff, and I see all 3 of our speakers are here. So great. The first thing we need to do was approve the minutes from the February 9th meeting. They were all sent to you on the committee. Can I get a motion to approve the minutes?
I move to approve the February minutes.
Second, all in favor?
Aye.
Aye.
Opposed? None. Thank you. Okay. All right. We're doing well when we have our education topic at the beginning, and I see that Bill just joined.
Yeah.
Yay. So what we've done is every meeting we've decided to have an education topic. We've covered senior issues before. We've covered the COVID issues. We've covered adolescence, drug abuse, children's issues, and we've also covered homelessness. And this week we are covering senior needs and issues in San Clemente. And we have invited the Senior Center, Age Well. Beth Apodaca is here. We've invited Jan Montague from San Clemente Village, and we've invited Emily Camarina from Alzheimer's Organization. So I will, you guys all, some of you have presentations, so I will let
You've got
you guys
me.
get started. We'll just go in order. Age Well was first. So I'll let Beth, and I don't know if you may have slides. If you have slides, I'm sure they'll bring them up.
Yes, I submitted slides, so yes.
So do you guys have her slides, Beth's slides?
It's a PowerPoint.
They would have gone to Janet.
Hi, Cade, do you have the slides? Yeah, we sent them to our IT department.
I have them. Which one would you like me to pull up?
The age.
Age Well.
Thank you.
There we go. So do I control them or do you guys control them?
I think they control, you tell them when to change.
Got it. Okay, so I did it on senior needs moving forward. That's the big question everybody has right now, moving forwards on it. So to the next slide, please. So food programs at the center are probably not going to come in. Lunch, the congregate program, till probably late in the year, maybe not then. There's a lot of things that we can do, but starting to sit people at a table eating and serving and stuff are not going to happen. So our greatest needs are still going to continue with being grab and go programs. Running our food pantry here has been very successful. Thank you to a lot of people in the community who have stepped up and helped us, and continued with home delivered meals. And those will all stay in place with the exception of home delivered meals until our congregate program comes back online, which is probably the hardest component to predict of all the components of the senior center because of how close everyone has to be together and et cetera. Next slide, please. So what we're doing right now is we're preparing seniors to get out and about again. We've talked about this before. The first challenge is to help them re-enter in society. Many of our seniors have not stepped out of their homes in over a year. There'll be many programs and lectures. We have doc talks set up and everything to help them take that first step. I mean, we have a handful of seniors that are ready to run down tomorrow, and we have some that, no, not yet. We're not there, you know. And so we've kind of doing the little things ourselves. Our case managers are starting to do porch visits, which is something we haven't done. We go to the porch, we're just trying to check in. So many of them we haven't seen in a year because we've had really strict standards, but since so many of them have been vaccinated, we can get a little more one-on-one with them. Our Meals on Wheels drivers check in with them daily, kind of keeping their spirits up, you know, just telling them to hang in there a little bit longer. We are mailing each week activities, you know, puzzles. We're doing Zoom. We're doing everything that we can to keep them engaged and mentally alert. That's one of the things that we're realizing, that they're mentally, when you're home, you're not being challenged. You're not doing different things to stimulate your brain. And we're trying to prepare them and make them aware of the changes that are going to be coming. And when they're ready to come, we'll be here for them. And to let them know that sooner than later, it's going to happen. We're really getting there. As we all said, we're excited to see the light at the end of the table. And then the next slide, please, is my last slide. It was just a simple thing, is it's time to get moving again. So we will be opening, the first thing that we will start with will be passive exercises here. Keeping with the thing is, you know, no heavy breathing, you know, everyone kind of, you know, wearing a mask, getting out there. The balance and mobility class, we've had so many seniors that have fallen this year because they weren't able to continue. We have so many broken hips and knee replacements. It's just been a very kind of sad and frustrating year because of something simple as a balance and mobility class could prevented so many of these accidents. So we're going to work on those first. We'll be doing strength and flexibility, trying to keep most of these in a chair, you know, trying to help them rebuild and regrow. Chair exercises were, you know, one of the key things that we want to do. Again, we try to send them home and have them do them on Zoom, but they don't want to do them alone. They don't want to do them in front of a computer. They want, and like we all talked on a meeting today, they want to engage with people around them. It's a little socialization that goes along with all of that. So Tai Chi will be another one that comes out. It's very calming, you know, no exercises. Zumba classes won't be coming, you know. Chair yoga we can do because we can isolate. Yoga on the floor is still kind of tough because people are too close to each other. I don't know. People are saying when. I know the state says that everything's going to open up June 15th. The senior centers won't be opening up June 15th in a lot of ways. We might be doing some exercises. I hope our gym will open up. It's very easy for us here to keep our, you know, numbers down, close off a bike, take down a treadmill, and we can do a lot. And it's just as important to get our seniors back there because many of them do their physical therapy for their knees and hips and everything on our machines. And they like it. There's someone there to talk to, and they'll actually do the physical therapy that they're supposed to be doing on their own. So we don't have a magic wand. I can't tell you when it's going to be. We follow the guidance of the Office on Aging and who follow the guidance of the state. And somewhere in here, we're hoping it all comes together. I hope by summer, we are at least open our gym and our exercise classes for the sake of our seniors. So that's where we're at right now. So I don't know if anyone had any questions, but that's where, yes.
I noticed that you're open for different things besides the food pantry deal. What is your, are there hours and days or what's going on currently?
I know. So we had our first in-person meeting last night, you know.
Oh,
yeah.
okay.
Which I thought there'd only be 5 people, not 25 people. Really 5 people that shows up to the Zoom meetings. I'm like, where'd the rest of you all come from all of a sudden? Okay. But we have the major room open. It's really easy. As Jim was aware, is we can social distance 25 people without a problem in the room.
Yeah, because that's the first I've seen it open.
That's the first one we did. And then we're going to start doing the coffee chats.
Right.
So we're going to be having the community coffee chats again, same philosophy. We're spreading tables and chairs all over the room. They can do, we're going to trying to get Sean to do hybrid. So Do you want to do it on Zoom? We're going to try to figure out, everybody overtalks everybody is our problem when you're trying to do in person and Zoom. So we're going to try a coffee chat. We're going to give it a try. But everyone is comfortable with the doors. Like I said, this room is so humongous here. But other than that, we aren't open for too many more programs. We do the food programs. And that's kind of it. Our boutique, some people do come in during the day when no one's around and they shop at our little boutique in here and things like that, which has been wonderful because it's time for us to think about how to raise money again. Opening is going to be a little bit expensive because of all the procedures that'll be in place, but we're looking forward to it. Yes, Jim.
And I know you're not doing the vaccine clinic, but I noticed the vaccine, you're like a locus for vaccinations.
We are doing a vaccine clinic on Sunday. It was at Johnson & Johnson. And guess what happened?
Yeah.
So today the county turned it to a Moderna. So it's the health department does it. Athena's doing the bookings. I said, I don't want to ever book another one of those again. It was crazy the last one I booked. And you know what? It's local. They're now able to take Athena and aim it at age groups in certain populations. So when it went out to people who know about it, it went out to people over the age of 50 who live in San Clemente. So that's who the little small, so we're what they call a mobile pod, a small pod. That's who it's aimed at on Sunday. I personally wanted the one and done Johnson & Johnson, but I'll be back here in 4 weeks. It's like for the second dose. But but we are doing that. And if there's a need, we'll be more than happy to step up and help the city and do another one. So we did it as a favor to the city.
Are there any needs that you have that are more pressing than, I'm sure you have a lot of needs, but is there anything that we should know about that you really need?
I know. You know, right now we're back to needing drivers. Many of our drivers are going back to work. So Meals on Wheels. And like I said, even though the world may open in June, we're still going to be delivering meals through the summer. And then people are getting, braver. They're traveling. They're off and about again. So a lot of our volunteer drivers are off. We always can use food for the food pantry. We still are going to be taking care of seniors throughout most of the summer. And they're kind of liking the opportunity to be able to put a little request in and we just deliver it to their house for them. And it helps them where there's no charge for it because it's so graciously donated from the community. So it helps them out in a lot of ways. So, and then, like we always say, money, we're always looking for donations. We may be having, I think we're going to have one last community garage sale. It was so much fun last time and we made a lot of money. And since we're not using the building for anything else, we'll probably have one in June. And then we do blood drives here. So we've done a lot of things because we wouldn't be able to normally do, because the building has 300 seniors in it every day. But so we will be looking for some donations for the community. The rummage sale was a ton of fun, the one we did last summer. And it kind of helped us re-engage with many people in the community. It was like the old fashioned ones you used to have in a church, and people brought us amazing stuff and and we made some good money off of it. So that's kind of where we're at right now, but I'll let you guys know when we have it, just to get the word out, to get donations and volunteers. And then we might do a little, like a vendor thing in the parking lot. If somebody else has something they want to sell, the people will be coming through. Education, we're going to be open again for, insurances, like, and everything always. So it'll be a little bit of everything.
That's great. Well, yeah, let us know. That sounds wonderful. Really nice to get out again.
Oh my gosh. I know I went up this weekend to the Laguna Hills Mall. They had moved the vintage market that used to be at Saddleback. It's at the parking lot at the Laguna Hills Mall. It was so much fun to go out again. It's like, it was a big outside market. It was a ton of fun. So I enjoyed it.
That's great. Yeah, we have our village fairs back too. First Saturday now, but it's back behind the library. The next one I think is Jan, right? San Clemente Village. Yeah.
Thanks, Beth.
Thanks, Beth. Jan, you're on mute.
I have slides also. PowerPoint. Keep me on track. Otherwise, I could keep going on and on and on and on and on about all the great things we're doing. So Paula and Human Affairs Committee, thank you so much for inviting San Clemente Village to provide some information. What I wanted to do is show a contrast of where we were in providing services and where we ended up with COVID, and then our prediction of how we think things are going to go when things start opening up again. Of course, I'll be echoing many of the same messages that Beth provided. We're all experiencing some of the same things. But I wanted to take advantage of at least making sure everyone is fully aware of what San Clemente Village does. So we provide non-medical services and program educational events, things like that, to deal with social isolation. And we provide our services for people living in their homes. Now, one of the strange things we learned at the beginning of COVID, when we were under so many restrictions, was that our volunteers were having trouble coping, not being able to go anywhere and do anything. But our members, who are largely very late 80s and early 90s, who had been socially isolated for years, had already learned how to deal with living in their homes and not being able to go anywhere and do things. And so they were able to really help our volunteers deal with it. So we saw that as a little bit of a silver lining in kind of giving back to others. It wasn't just about them receiving. They were able to give some information back to our volunteers. So as you know, we do charge for membership fees. We do have a helping hand fund if someone's under financial hardship, but these are our typical services. But because we could not offer any of our social and educational events and many of our in-home services we could not offer, we have extended membership fees for a year and a half. So we have not collected any membership dues. We have not collected any part of that revenue stream since last year in March, 2020 of March. So if I could have the next slide, please. So here's our kind of our timeline. I wanted to remind everyone that it was 2014 when then Mayor Bob Baker brought the village concept to the Human Affairs Committee. And so we are in existence because of the Human Affairs Committee. There were a group of people on that committee at that time that loved that idea, got some other people around them, did all the research, the surveys, figured out how to open a nonprofit. And together we all launched this organization in 2016. I just wanted to remind everyone that San Clemente Village is in existence because of the Human Affairs Committee.
Yeah.
So next slide, please. So here's what we offered pretty much before COVID: transportation 2 or 3 times a week, a 20-mile radius, all sorts of home services, both in the home and outside the home. We ran errands, we walked dogs, we went to the grocery store, we called people, we did front porch visits, we did lunches on back porches, we did educational program, lots of social activities, and all of our wellness initiatives that included our Stay Well at Home, which is fall risk reduction, our village health companion. This is where we have someone goes in the doctor's office and takes notes while they're in the doctor's office, gives those notes to the members so that they can remember everything that was said in the doctor's office. So we have all sorts of different wellness initiatives. So these were all the things we were doing before. When COVID hit, everything had to stop, but we continued to provide grocery delivery, medication delivery. We walked a couple of dogs that really needed to be walked, that the owner could not walk. We still did like garbage cans to the curb. We started doing Zoom activities, but we have not had any success with our members getting on Zoom. Over 3/4, we did a survey, 3/4 of our current full members do not even have the internet coming into their home. So they have cable, but they don't have internet. We tried to get them to call in. We did bingo on Zoom, thinking that would get them excited to even call in, and they would not do that. So Zoom has been very successful with our leadership, our volunteers, our board meetings, but not for our members. So that was quite a disappointment. So next slide. So I wanted to put this in so you could see what we did in comparison, our metrics as we compare 2019 to 2020. So if you see transportation, we were in 2019 doing 751 transportations a year. We dropped in 2020 to 413, but I still think that's very respectable when you figure we weren't doing hardly any transportations to nail salons, restaurants, getting hair done. Those were emergency doctor appointment type things where their body had to be in the doctor's office. We were able to get almost all of our other members switched to doing telemedicine. So we had to do a lot of help coaching them on how to take those telemedicine calls. We did have quite a few members pass away in 2020. This was not due to COVID, but we had quite a spike in deaths from just general health conditions. So we were able to grow the membership a little bit to make up, but we could not do any member recruitment because we really couldn't be in front of people to get them to join. So the next slide, please. So these are our current and future needs. Right now, we need visibility. Villages all over the country are closing. They closed in 2020 because of financial hardship. We're able to be open, but we need help with visibility and promotion. We also need people to help us with our leadership recruitment, really building our board and our advisory board. Volunteers, as Beth mentioned, we lost about half of our volunteers in providing services. They just were not comfortable driving somebody in their car who was that was pre-vaccination, that close to one another. It was too uncomfortable for them. And then, of course, member recruitment. We've got to find a way to get back in front of clubs, organizations, and groups and get our message out. In the future, we definitely had a hit with not receiving any membership dues during COVID, but we had to take that chance that somebody might even think that they couldn't afford their membership when it was so crucial that they had our services at this time. And another thing, we hope in the fall, again, it's like throwing darts at a dartboard. We have no idea when we're going to be able to provide our social and educational programs. We're hoping by late summer, early fall, and I'm hoping that the city will still continue to give us a break, a financial break on using the community center rooms, or that they'll find a way to help us offset those fees so that we can get things back up and running again. So that's it for San Clemente Village. If you have any questions.
I'm just glad that, go ahead. Tyler, go ahead, Tyler.
Oh, yes. Well, thanks so much, Jan, for being here and for your presentation. And it's kind of a question about, the San Clemente Village and the Senior Center. I was just kind of curious, the membership of the village, is it similar to the, population in town, or is it the same people that use services at the Senior Center as are also members of the village, or are they completely separate population?
Completely separate, yeah.
We only have a few crossovers.
Yeah.
Got
And that would be mostly our social members who are younger and vibrant and do access the Senior Center, but almost all of those people are volunteers and they're a social member to support the organization. Our full members largely are in their 90s, even over 100. They haven't driven for a long time. They're very socially isolated, but they are not moving out of their home.
Mm.
They're going to stay in that home no matter what. And but their health, most of them are very healthy. They just need help staying in their home and going to the doctor or grocery store. Yeah.
Thank you.
Well, we'll get the word out that we need volunteers. Drivers and volunteers for both of these organizations. I think
Well, Jan and I both lost a very popular volunteer, Miss Tracy Carter,
Yes.
who moved on us, who was here every day through COVID, just as an amazing volunteer and did so much for you.
She did.
I
Mhm.
know.
Yeah.
Did she just physically move out of the area, or what happened to her?
They bought a new house. They want to go live in the mountains.
Yeah.
They retired, you know, that was their goal. And so they're living out their dream.
Mhm.
Well, I'm not moving. I'll volunteer. I'm not going anywhere. I stay there. Okay. Next is Emily. Thank you, Jan.
Thank you.
Yes.
Yeah, good job.
All right. Hi, everybody. And thank you so much, Tyler and Paula, for the connection and the introduction to be here. I'm really excited. I'm representing the Alzheimer's Association. We cover the entire county, but in the last couple of years, we've really worked on establishing a stronger presence in San Clemente. In fall of 2018, we held a community forum, which we wanted to hear from those in San Clemente. What do you need from us? Where are there gaps? How can we be helping? And so out of that, we started a support group, which thank you, Beth. The relationship there has been great at the senior center. We held that support group there until, of course, COVID, and we did go virtual with it. Unfortunately, the group members did not want to continue if it couldn't be in person. So we're, understandable, and still happy to offer it again virtually if that is brought up again. And then we have, during 2019, we held a couple of programs there, like a legal and financial planning. These were all out of the forum, the requests that we heard from the forum addressing the needs of the community. And I do have a couple of slides, if those could come up. One of the things that in the first slide, it discusses how Alzheimer's has the impact on the families. And I know today we're talking about senior needs, but Alzheimer's is a family issue. Not only is it the seniors that are living with Alzheimer's or a form of dementia, but then really those that are so greatly affected are the caregivers supporting them, many of which are in that caregiver generation, caring for their aging parents as well as their school-age children. And every year, the cost of unpaid caregiving, you can see here it was valued at close to $235 billion. And so the needs just to support those caregivers. And during COVID, we were really able, in some ways, for the caregivers, the ability that we moved everything virtual was a huge blessing. More people were able to get the services that they needed if, they weren't able to get out of the house before. So calling into a support group or calling into an education program. So we are excited, of course, we're all excited, as everyone's been saying, to be getting out of this period that we've been living in, but glad that now we will certainly be continuing all of our virtual options, as that was obviously so well received and needed for those that are Alzheimer's caregivers. You can go ahead to the next slide. This just focuses again on the need for education and support groups. So I can follow up with everyone and send out our monthly calendars, but we, again, everything from 10 warning signs, noticing people being comfortable talking about Alzheimer's and dementia, to communication strategies for those with the disease. And the support groups as well are available to anyone. And again, just one of our biggest passions, I guess I would say, is that we want people to know about us before they need us, because far too often everyone finds out about us randomly, somehow, after the fact, after they've struggled through this very difficult journey, which is often very long, given the fact that, 65 is considered normal onset for Alzheimer's, and people can live with it for a good 20 years, if they're healthy otherwise. So it's definitely a journey, and we want people to know that we're here for all of the stages. And so I guess just, I'm really excited again to be here today to share that we're here and we want to be helping. We are a resource. We have our 24/7 helpline, which is an amazing tool that anybody can use, whether it's in a crisis moment or it's simply you think you are seeing signs of Alzheimer's in one of your loved ones and you just want to talk to an expert, master level care work, social workers and clinicians. So definitely encourage you to spread the word on that to anyone that may need it. And one of the ways that we get the word out about the Alzheimer's Association, if you'd like to go to the next slide, is our Walk to End Alzheimer's. And so we held this, I'm not sure if the video is going to work. We held our first one in 2019 at the outlets in San Clemente. They were gracious enough to allow us to be the first nonprofit organization to do a walk there. And so this is just the aerial view of the turnout that we had during that first event. And it was just clear again, seeing the community come together, that this is affecting. Great. If you want to, is the sound shared as well? I'm not hearing anything at my end. I don't know if you have the sound sharing. I guess I'll just, should I keep talking over it, or are you going to try to restart it with the sound? Cool.
I walk to remember my grandmother, Marjorie Ford.
I walk in honor of my parents, Henry and Janice Marr.
We're here to support our sister Katie and all of those others that are working through Alzheimer's. Katie was diagnosed with Alzheimer's at 50, and so we're here to support her and the Alzheimer's community.
We're walking for Katie today because she's the bravest person we know.
At the age of 48, my husband was diagnosed with young onset Alzheimer's, and I had no idea what that was, didn't even know it existed. And unfortunately, he passed away at the age of 52, which was 7 years ago.
I walk to end Alzheimer's. It is a disease that all of us are touched by, and we must join together to find a cure.
It's the 6th biggest killer in America and the 3rd in Orange County, and we don't know why we get it, and we don't know how to cure it.
I walk because I care about finding a cure for Alzheimer's and seeing the first survivor walk with a white flower in their hand. These walks bring us all together so that we can celebrate those that have Alzheimer's and those that are caring for Alzheimer's patients. The walks raise the critical funds that we need to fund the research.
And we need to find the research to find the first survivor and stamp out this disease.
I'm Linda Rayburn.
Matt Bowen.
Tom Bowen.
My name is Janice Trojan.
My name is Mary Machado Shamel.
I'm Stephanie Paul.
We walk because we know the first Alzheimer's survivor is out there.
The first survivor of Alzheimer's is out there.
I walk because I know the first survivor of Alzheimer's is out there.
I walk because I know there is the first survivor out there.
And I walk because the first survivor of Alzheimer's is out there.
Thank you so much for sharing the video, and thank you for any of you that were a part of our walk in 2019, and we of course did go virtual with it in 2020, and we're excited, if you want to flip to the next slide please, that we just confirmed with the outlets a couple of weeks ago that Saturday, October 23rd, we will be having the walk again. So we are definitely moving forward, hopefully optimistically that it will be possible for us to gather safely. Of course, the health and safety of our walkers and volunteers is our utmost importance. So we will find a way to make this event possible in person for 2021. So we're very excited about that. But you know, as our slogan is, Alzheimer's isn't stopping, and neither are we. Sadly, during COVID, we saw even more deaths from those with the disease due to things that Beth and Jan were talking about, of the isolation. And for those, for Alzheimer's, you know, it's so important to stay engaged and to stay active. And so unfortunately, COVID and the isolation that brought some more deaths than it normally would from Alzheimer's or dementia in a year. So would love to invite anybody who's interested in being a part of the walk. We have a planning committee for that. So if you're interested in that, or if you're interested in helping us provide more education and support the community, I can connect you with our team that works on all of that. So lots of ways that we can help, and that is what we want to do. We want people to know that we are here as a resource for them going through Alzheimer's or dementia. So thank you again.
Thank you, Emily. That was great. Thank you. All three of you was very enlightening.
Very.
We'll be in touch.
Okay.
Okay. Okay. You're welcome to stay and listen to the meeting. You don't have to. Don't feel obligated. We have a few more things to discuss. Going on to, I don't have any special presentations. I don't have it. Oh, Tyler. Did you? No. Okay. Okay. So then going on to item 5. I don't think we have any special presentations or letters. The social services grants. I just wanted to give you an update. I don't have the dollar amounts, of course, but we did we approved money for the organizations that did submit grants. I don't know what the final numbers are going to be, and they did warn us that if they don't have a budget, there might not be money again this year, but I'm starting to doubt that. I think hopefully we'll have some money this year. But we did award to Age Well, to Assistance League with County Valley, the Girls Club, Christ Lutheran and St. Clement's, COA, FAM. First time applicant, we gave some money to Find Your Anchor, which is suicide prevention, First Amendment Voice, I-5 Freedom Network, Parent to Parent, San Clemente Village, and Wellness and Prevention.
Good.
Yes.
Good.
So that's good. And then the CBDG funds, we awarded money to Camino Healthcare, City of San Clemente, FAM, and Laura's House. For those, that money comes out of the federal government, I believe. So that we'll keep track of that. And I think Janet at one point told me about a workshop. I don't know whether they still having that workshop that you were talking about for the budget.
Yeah, the date has not been determined yet, but as soon as it does, I will be sure and let you know, Paula. The CDBG is going on May 4th to council, the annual action plan that will have those awards in that for approval.
CBDG is going there. Okay. Okay.
Yeah, one thing, Paul, if I could just to mention, through the American Rescue Plan, the city of San Clemente received, I think, just shy of $9 million, or will receive, and it's still unclear exactly how those dollars can and should be spent. But there was a city staff member on the San Clemente Times coffee chat last week, and just kind of put a bug in the air. Perhaps, the social service grants from last year and this year, maybe we could use those funds for that purpose. And so perhaps that's a possibility. Just wanted to kind of put it out there, and hopefully those funds can be used for a purpose like this, because it would certainly benefit the community.
The last,
they would retroactively fund like the approved grants from last year.
I think that it's kind of unclear from the council's perspective. I think it's been discussed that they would review at the mid-year budget review, which is coming up, the social service grants from last year. But whether that actually happens or not, I'm not sure. I know that what we just approved, the organizations that Paula just listed are in the queue for this coming years. But how those American Rescue Plan dollars can be used, I'm not really sure. It's pretty unclear, actually, I think, even from the federal level at this stage.
Well, I think we just have to stay on top of it. I know they got money last year and they said they had to use it for COVID, even though they wrote us out of the budget because of COVID. So I think we just have to stay on top of it and just not let it get out of our sights and double the amount of money that we need so we can get the money this year and get back the money from last year. So as long as and just keep it in front and center, which is one of the reasons I wanted to go to that workshop, so that it's just, we understand the mechanics of it, because I don't think City Council was aware of what they were approving, and it was pretty hidden. It was hidden deliberately. It just wasn't as obvious as it should have been, in my opinion. So we'll stay on top of that. Thank you. Okay. Next item is the resource guide, and we are almost done. I'm getting input from those people that gave me their pages. Jim and I are going to make a final, whatever you want to call it, run around on Friday. We're going to finalize everything on Friday, and we'll get it over to, I guess we'll get it to Janet. It'll be a Word document. I think I've converted the PDF to a Word document, so we'll send you a Word document. It's going to, a couple of weeks, it'll definitely be done way before our next meeting. But we'll get it over to you, Janet, in the next month.
Okay.
So that's good news. And more good news, the high school, this is for Toby and me. I finally got a hold of Stephanie, between her having been maternity leave and then the COVID and then the spring break, it's very difficult to get a hold of her, and no one's really there anymore. They're all, in email. So we did write a letter announcing the award. We did, so that the faculty would get that letter. We did put together a questionnaire. Toby and I put together a questionnaire for the kids to answer. And I heard this today, that the teachers have actually nominated kids, which is incredible.
Yes.
They are going to be interviewing, we'll be interviewing them, and it'll be Zoom. So that's where we are. I haven't set a date. I know it's Zoom, so that doesn't matter. I mean, we don't have to go anywhere. The biggest challenge is going to be, personally, I don't think they want a clock. Every year we've given them a clock and a plaque. And I don't know if kids, or even when you go to college, whether you need a clock. But I'm welcome to suggestions, and I'll talk to you offline, all of you offline, about what we might want to give the award winner. Because things are so different now than they used to be. Whether it might be a tablet or an iPad or something. And yes, definitely something they can put on the wall that's an award that like the mayor would, announce this person. And of course it would be at a city council, and all that's going to be the same. But I think the physical piece that they get should be something a little bit more modern than a clock. But I'm welcome to suggestions. And
especially if it's analog, they don't know how to tell time anymore.
Yeah. So that's good. And then all of them will get followed afterwards. And we made that pretty clear, that whoever gets nominated, and if they don't know it, Toby and I will tell them that they will be followed in their senior year by the Human Affairs Committee, whoever they are.
And not stalked.
Right, followed, yes.
Yeah.
Engaged.
The difference.
Help them with whatever they need. I just heard, Esther did go to Columbia. In fact, there was a New York Times article the other day that she contributed to. About, I won't talk about what it's about, but she did contribute to it and talked about our city in the New York Times the other day. So we will definitely stay in touch with these kids, and I've missed last year very, very much. I feel very empty that I wasn't able to do anything for last year's juniors. Yeah. But hopefully we'll be able to keep this going and revive it and keep going with it. So I'll let you know, Toby, what day it's going to be.
Okay.
Or days. then we'll have to figure out what the award is. And Janet, there'll be something that you'll have to frame. But we'll figure all that out. I don't know whether, Janet, you have what we had 2 years ago. You probably still do. So there will be something that will have to be framed for them to receive. So I'm really excited about that. And then the next thing is the Joint Homeless Subcommittee. What's going on with that? Tyler or Bill?
Yeah, so the subcommittee's been continuing to meet on a monthly basis, and I might have mentioned this at our last meeting, but our final work plan really just ended up being focused on homeless outreach to support this incoming staff person that's about to be hired with the city, who would be the San Clemente, city homeless outreach coordinator. And so our efforts are really just tied to trying to support that person as they come into that role. And what seems to be probably potentially the most impactful piece of the work we're doing is we are putting together a stakeholders group of homeless outreach organizations, whether it's, FAM, we're reaching out to CityNet and Mercy House, faith-based groups in town, or the sheriffs, marine safety, of course, code compliance, as well as this this homeless outreach coordinator. We just kind of want to form a group that meets at some frequency with each other to support each other and share notes and see how they can improve on what they're doing individually and collectively. So we've gotten some really good feedback from people on that, and I'm not exactly sure the timeline for when the staff person will be hired, but it probably would be a couple of months from now, I would expect.
The staff person that takes the place of the CityNet, that's the staff person. So we have no CityNet, right? And we have no staff person. So there's,
that's right.
Which I thought was going to be a couple of weeks, is turning into months and months.
Oh, yeah.
Yeah, the process for hiring is, takes a while, putting together the job description, listing the job, getting, applicants and sorting out applicants, conducting interviews. And then once they finally select somebody, going through the onboarding process. So it is quite a process. And like you said, Paula, the council voted to halt the contract, which was kind of on a sort of monthly basis at one point for CityNet. And I think currently they're reviewing other alternatives to CityNet, including Mercy House. So I think at the next council meeting, we may see something to that effect. But for the time being, there's no actively contracted outreach service with the city. There are case workers from FAM. There's OCSD out in the field daily, but there's no one actually contracted with the city for outreach.
That's, at least there's somebody reaching out. I was worried that it would be anybody.
Yeah, there's only, if you remember, there's only 4 people on this whole committee, so it makes it really hard to meet. So the minute any more than 2 of us get together, we've violated some kind of national prerogative of some kind. Anyway,
Brown Act.
Brown Act. But anyway, so we're unable to do anything real substantive yet until this new person starts, which probably we're looking at July is my guess. And then we offered to help on the interviews and things like that. But the 4 of us are getting along very well. I think we're all in the same mind, and we're conducting interviews with people around just to learn some things ourselves that we didn't know before. And so that's good. So the positive things are happening, but it's very slow.
Has the state of homelessness, I mean, that's a very general question, but in your opinion, over the past year, have things changed?
Yeah, we keep asking the question about how many homeless do we have, and we get estimates anywhere from 27 to 200 and something. And speaking with the sheriff's department here and speaking with FAM, nobody really has the number. And our chair, who's doing a good job, his name is Gary Welsh, is really doing his best to try to identify where the database is and should be for this kind of activity. And there really isn't any, and it's frustrating for us. And the city now is going to be ordering a copy of whatever database is out there for us to be able to use as well. So that we had not, as a city, been included on that database list is not awkward. So we don't, the answer is we don't know. The best guess of the officer that spends most of her time out in the field, whose name is Molly, is that there's about 100. So if we had to throw a number around, I think that'd be the number. We're right around 100-ish. And they're spread a little more around the city now than we've been experiencing in the past. We tried to get them all to go up to the I-5 office building and just hang out there, but that's not working. Good idea.
Brenda, you're on. Oh, there you are.
Yeah. So regarding the homeless, Bill, do you know, are they approaching homeless as one global issue, or are they approaching these by the different kinds of demographics that homelessness has now come to be defined? Because I think that there's the homeless that we see that we're most troubled by, which is the chronic service resistant homeless, which are mental illness and other kinds of things, you know, those people that we see. That's one kind of homelessness. Are they approaching these at different sort of causal factors, or is it just one big approach of homelessness? Do you have any idea?
The city so far, from what we can learn from FAM and our contacts within the city government, what's his name? Our main contact, Tyler, I've forgotten his name.
Is it Adam Atamian?
Yeah, Adam, yeah. Is that it appears to me like there's this big old bucket full of definitions, and I think in the original piece that I wrote up a couple of years ago, you might remember, I mean, we talked about all the different possibilities for how somebody gets this kind of condition, and there hasn't been any attempt to organize around that yet. But I'm just laying for them to be able to get this person on board, because everything is kind of slowed down to a screeching halt in terms of trying to do anything real substantive, except we have learned that there is an interest right now in kind of bringing our 3 local cities together.
Good.
What is this? Capistrano, San Clemente, and
Dana
what's
Point.
the other?
Dana Point.
Yeah, and Dana Point, regarding doing some things. In other words, if it hasn't even been decided to what to do about a shelter yet, really. So if there is one being built, should that be for all 3 towns or just for one? And how should all that work? So we still have a lot of work to do, but that would be real important. But we're kind of hamstrung now without this person on board, because they see this person kind of taking the lead on this.
What is the background you're looking for on this person? This mysterious person?
Whoever wrote the job description for this job, I think, did a pretty good job. But Tyler, from what I remember from it, I don't have it here in front of me. They're looking for a degreed person with some case management kind of experience. So they are looking for a few years experience, which is a good thing. Mm-hmm. But nothing necessarily directly related to homeless. I mean, this is getting to be a really complicated issue. It's got legal ramifications, social, I mean, medical. I mean, it is just all over the place. And to really get into it, you really gotta have to have somebody full time that's kind of looking into it. But they're trying to call this job a coordinator, although I don't think that's good. I don't think the council's going to give up that much control to anybody, frankly.
Yeah, one thing just to add to Bill's response to Brenda about how they're interacting with different people. One thing to mention is that the Orange County Sheriffs have implemented a program called PERT, and so it stands for Psychiatric Emergency and Response Team. So that'll actually be an individual who rides along with a unit, and in the event that they have sort of a mental health scenario that they need extra help to support, then that PERT individual would go on site and be the person to interact with them as kind of a first contact. And so the idea is really to offer an added layer of interaction that is better trained on particularly mental health, mental illness issues and whatnot. So hopefully that'll help. But to Bill's point also, just in general, one of the biggest issues isn't even necessarily trying to fit people in the right places or getting people to accept places to go. A lot of it's just challenges of having places to go. There's a bottleneck of where to send somebody or where to take somebody, even if they're interested. And so that's the feedback we've gotten from a lot of kind of stakeholders and players in this space is, from OCSD, from FAM, from CityNet is, if there's not bed space to take people to, then there's not much that they can do out there. So that definitely is a prevailing issue on this.
Yeah, one really encouraging thing is, and for those of you who are following FAM, we've spent a couple of hours with them now, kind of talking through where they are, what they're doing. They moved their offices, don't you? Probably to the end of the street. Negocio, is that the name of that street? Negocio, at the kind of at the cul-de-sac down there. But they're now up to 10 case managers, and I think from my own philosophical point of view, this is a case management issue, and they're really anxious to get staffed up to 10 people, and they've just gotten a new grant, another $5 or $6 million to work with.
Yeah.
That will help them. So what we're trying to do, I think what we will try to do, is to try to bring as many of those resources together as we can, and as long as the council kind of leaves us alone to do that, we'll be okay. Leave us alone.
Yes. I heard that.
I can't get my picture up on this thing. How do I do that, Tyler?
It's the bottom left corner of your screen.
Where it says mute?
Icon that says
right next to it.
Start video.
Start video. All right.
Oh, that one. Okay, that one. Oh, see, that's no.
Oh, wow. It was better the other way, Bill, but that's okay.
Yeah, that's what I thought.
Okay.
I knew that was going to bring that up. Okay, great.
Well, thank you. Okay, thank you. So getting into section 6, we have one more meeting for this fiscal year, and the education topic needs to be determined. Last year, we spent all of our time on homelessness, and then this beginning of this fiscal year, we did one of everything else but homelessness. So we could circle around back to homelessness, but I would like to add affordable housing in there as well, and some of the other peripheral things that go along with that, such as financial literacy and things like that. So, but we don't have to decide it right now, but I'm sort of leaning towards, coming full circle with the homeless issue in general. Maybe by June we'll have someone, maybe we won't, but we probably should be educated so that when someone does get hired, we can then, impart our whatever we've learned, along with everybody else in the city is going to want to impart what they've learned as well. But I think it might be a good thing to highlight that in June. The timing might be right.
Fine, we can brainwash them by that time. Yeah.
Yeah.
Housing affordable housing is an issue. One reason, because it's another one that's affecting another spectrum one, because it affects older people. They call it the silver tsunami. That a lot of people do, because of the cost of living and the cost of taxation and the cost of this and the cost of that, are kind of leaving here and going other places, just like other people are leaving, say, San Francisco and coming down here because the affordability factor. And there really isn't what you would consider low income housing much in the community. You know, there just isn't. And that would go for Dana Point, San Juan, the immediate area around here.
Yeah.
And so that is an issue, you know, that there just isn't what you would consider starter homes or entry-level homes, or even places that people can afford to live. You know, housing is very, very, very expensive, and all the new housing is pretty much very, very pricey.
Yeah.
Are there so so let's just say somebody had a parking lot and they wanted to build, you know, multi-unit thing with parking, and they had all requisite permits and things like that. Are there subsidies if they want to make that low income from the city of San Clemente? Is that a state driven thing? Like, and what are the, you know, does anybody know?
Good. It's a
The
good question.
state
There
and-
is state
and county.
funds for, I know, for converting things. Probably the one to be most knowledgeable is the one that took over that the building that used to be the baseball player apartment up there, you know, up in North Beach area, where they came in, and the controversy is they displaced low-income residents that were living there, and you know, put basically people in there that had a greater need for housing, right? And so,
Well, think about like that.
Kind of, there allegedly are funds available. It's kind of one of those interesting ones where the cities have their part, the county has their part, the state has their part, and it's a very tricky issue that comes under that that thing
I'm
we're
just trying
involved
to
with, the housing
trying
plan.
to
Right.
figure out what's the incentive for a developer to want to make something low income when they can get regular income, and you know, what is the requirement for the city to subsidize that or to have that available? I'm thinking like 1010 Santiago, if anybody knows where that is, like on El Camino, or is that what it is? Yeah, on El Camino in Santiago, they built a brand new building. It was an empty lot. They built that up there. Clearly not low income. But I'm just thinking, what's in it for a developer to choose to go with either Section 8 or low income type housing when they can get such big rents? And how do we leverage?
Incentivize.
Yeah, incentivize that.
Right.
Yeah.
That probably is exactly it. I think that most, you know, they can build and sell things for, you'd be hard pressed to find anything for under $800,000, I would imagine, in the city, right? And Dana Point too, maybe in San Juan. And that's part of it, you know, the cost of land, the cost of building, the cost of permits, and the restrictions on what you can put in, you know, like size and shape and architectural design, drives the prices up and up and up and up, right? And so, yeah, I think you're exactly right on that. It'd be very tricky to do that without some, let's say, windfall of money from someplace. But allegedly the money does exist. There's state funds that go through the county, that get to the city. You know, I just know of it for converting things. I don't know of it for new construction.
Well, isn't there a housing element, Tyler? You've been to some housing element meetings where there's zoning. You want to talk about that?
Yeah, the planning department is in the process, I think, of sort of reestablishing zoning for affordable housing in San Clemente. And so they're looking at different areas and trying to get community feedback on that. I think that's one way that the city participates in trying to kind of meet the affordable housing goals that the state sets for us. Another way is having like a requirement of incorporating affordable housing into any housing development. Like, for example, Santiago, they may not have incorporated affordable housing, but they would have had to pay a fee in lieu of incorporating affordable housing. So there's a fee that accrues within the city's general fund that that is from those development fees, the in lieu fees for developers not incorporating affordable housing. And I think they've used those funds in the past for projects like Cotton's Point, I think. And so that's one way that they're able to do it. But I think they're just trying to now get more creative with the zoning to try to actually encourage people to build or to develop or redevelop properties to incorporate affordable housing in a more active way, rather than just paying the fee. Because right now, any developer, as it's been discussed in the planning commission meetings, wouldn't be incentivized to actually incorporate the housing because it's cost negative to them as opposed to just paying the fee.
If the in lieu fee is not, that can be recouped with one sale or use of, obviously that's going to be an easy thing to do. Do you know if that in lieu fee is being, kind of earmarked or whatever the term is to make sure that in lieu fee goes to support some sort of, that has to be used for supportive, housing?
Yeah, I believe
income?
so. And it's, I think it's just accruing right now. So I don't know if those funds are actively being used. I think it's just accrues until maybe it gets to a point where there's enough funds to execute on a project. But yeah, I think it is, to your point, I think it is earmarked specifically for affordable housing.
Other states have taken the incentive of taking the builders, I can think of 3 together, and reduce their corporate tax structure for as long as a 5-year period. If they would get together and it's part egalitarian, part philanthropic, and part it's a good deal. But I don't know. I don't hear any of that in this particular state. Well, everything is regulated to the nth degree. But from that, these 3 builders put together I guess it would be like a condo project. But it doesn't look like a tenement building. It looks like somewhere that a person could start or, not fear for their life living there, but as in a section of Dallas, what I'm referring to. But I don't know.
There's one on Sarah that's was just designed for that. You'd never know. And like Tyler points out, the Cotton Point, and there's a few other areas that are low income areas in town that you wouldn't know. I don't know all the low income areas because some of them blend in, like the one on Sarah, you'd never guess because they're all well cared for. But there are low income housing projects for seniors and for other people in town. I just don't know personally where they are, but I know they exist and I know certain ones, but I don't know them
at the
all.
end of Pico. And I hear that there's a 3 to 5 year waiting list for some of these places. So it's
Yeah,
very, very difficult.
that's part of it.
I think it's important as we talk about this, knowing the astronomical, how difficult it is to buy property where we live, that it's not because they're low income, it's because the housing is unaffordable. When we say low income, we automatically start thinking about people who haven't graduated or have menial skills. We have people who can't afford housing that are working professionals. Yes. And so I think it's important that we make that this isn't low income, this is affordable housing because we live in a very difficult to afford place.
All right.
And I think when we shift that language, it'll make it a lot easier for people to start. We don't want to talk about low income, we talk about affordable housing.
One thing that is very clear to me, being in corporate America for 40 years, people aren't going to the office. I have customers all over the country and no one is in the office anymore. And there's a lot of empty office buildings now.
Mm-hmm.
And I mean, I know Cisco's not going back to work. I know Apple's not going back. Facebook's not going back. Probably Yahoo and eBay, they're not going back in the Silicon Valley. So there's a ton of, they have tall buildings. They don't have what we have. We have Rancho San Clemente, but to me, going along with Brenda's idea, which is not the homeless, but lower income starter homes. I don't know why we can't take those office spaces, redesign them. They all have bathrooms. They all have secure doors and locks. There's emergency facilities. There's ways to get around. There's elevators and stairs. I don't know why we can't convert them to like tiny homes, but inside a building. So they wouldn't be like you wouldn't walk out to your garden or anything. You might have a patio. I don't know why we couldn't convert some of those to tiny homes for some of these people. Maybe not I mean, it's like an apartment, but maybe with some services or just, it just seems like there's going to be an awful lot of office space that's going unused, and people need a place to sleep and a place to start to thrive again.
Like the old city hall.
Huh?
Yeah.
Like the old city hall is sitting there empty.
Yeah. Or
You're
that,
right.
yes. But I mean, I don't, most of my customers no one is in the office anymore.
Yeah.
So what's in these office buildings now? Nothing.
Well, I
So,
think since this affordable housing issue is all part of the solution matrix involved in homelessness, well, why don't we get somebody to come in to talk to the group who really knows the substantive details behind all this and can quote numbers? And so I think your idea that you started with here is a really good one. That put that on the education list and
I agree.
okay, well,
train us. Train us.
if we
We're
don't have a
trainable.
big agenda next week or next time, we can have an hour meeting, an hour presentation. That would be a great idea. So
Yeah, Paula, you mentioned Mendocino Apartments, and I've been getting our Rotary Club involved in volunteering there. And that's operated by Jamboree Housing, which has a pretty large kind of mix of different types of affordable housing facilities kind of under their ownership. And so I could reach out to them and see if they'd be willing to come and speak with us about kind of that entire kind of matrix that Bill's talking about, the whole spectrum.
Yeah, we have a guy in our church too, who is very involved in this kind of thing, putting proposals together for the city government. His name escapes me right now, Brendan, but I think I can pull that out too and maybe suggest him to you too. He's a good
So-
guy. He's a Presbyterian, so he's probably all right.
Don't count on it.
As long as he can spell
We like to make
Presbyterian,
things
we
really
like it.
difficult and layered and
said, Brenda.
bureaucratic. So if we want to take a lot of time to do something, a Presbyterian is the right choice.
Yeah, there you go. That's good. They'll have lots of different meetings. Meeting happy. Okay.
okay. I'm gonna turn it over to Janet, talk about our terms and our reports. Janet?
Yeah, so at the April 6th council meeting, they extended the term of your appointments for 60 days.
Did they give a reason? Are they gonna move us back to 7 people, or they just don't have the time to interview?
Yeah, it's a time issue, I believe, but you could go watch the council meeting on YouTube to find out exactly what they talked about for the reasons. And then the other issue is your annual report, Paula. So you'll have to tell us like what council date, either June 1st, June 15th, that you would want to present that to council.
I don't care. I mean, I can write it tomorrow. The last 2 years I've done the award and the annual report the same time, but that's because I had to be there. Now that it's Zoom, it doesn't matter. I don't know whether it's going to be Zoom in June. But if you need a date, I'll let you know as soon as possible. The award, I mean, Toby and I will have to figure out the award date. I know that school is not in session the June 15th, but it is in session June 1st. So we might want to do the student award June 1st, as long as we can get the information. We might not have to have the quote unquote clock by then, but we definitely need to have something to give them.
Yeah, I know in the past, like the clerk's office puts together the plaque. So they'll get the plaque from the clerk's office. And I know last year, or well, not last year, we lost last year, but the year before, it was just the plaque.
Right.
So there was no.
Oh, okay. All right. That's Luann. Okay.
It was just a plaque.
It was. Okay. Good. All right. Well, that's fine too.
There was no clock. So, but yeah, either one, the 1st or the 15th, those are the 2 council meetings.
Okay. Would they be doing city council in person? I know they're doing one next time, sort of in person.
That I don't know, Paula.
I don't care. All right. I'll let you know.
And then you should schedule, ideally, you could schedule both on the same council meeting, would have the state. award.
That's what I've done before. That's what I've done before. So that's
Yeah,
June,
that works.
probably, you can pencil it in for the first, only because like, we want the junior to be still in town. We don't know what people are going to be doing after school's out. So it'd probably be best to be the first. So is it okay with Toby?
Yeah. I'm not moving to the mount.
I'll look at my calendar, see if there's anything that comes up, but right now I think the first is fine. Okay. So the next meeting will be June 8th, which would be, I would have presented the annual award and the student award the week before. Can I get a motion to adjourn until the June 8th meeting?
So moved.
Second?
Second.
All in favor?
Aye.
Hey.
All righty, we'll see you guys again.
Hi, folks.
Stay healthy.
Bye.
Bye-bye.
Thanks, Paula. Thanks, guys.
Thank you.
Good job, Paul.
Yes.
Leave. Okay, leave.